So terminology in surgery and surgical procedures gets really confusing sometimes. And there's two procedures we get questions about a lot, and that is canthopexy and canthoplasty. And both of those procedures refer to us tightening the lower lid and either when we do fox eye lifts, those types of brow mid-face lifts, and getting this corner of the eye to be sharper. When fox eye lifts were getting popular, people were doing very extreme versions of this. But a lot of times people just need a subtle little tightening here to make that edge a little sharper and give a nice shape to the eye, almond eye, whatever you want to call it. So what is the difference between those two procedures? So a canthopexy is when this canthal tendon here is tightened without cutting it. So we don't have to cut the tendon and release it, and we just tighten it up so that we can get a sharper angle. But also pretty much with almost every lower blepharoplasty surgery that I do, we do a canthopexy to help support the lower lid during the healing period. Even if we go a transconj approach and there's less risk of lid retraction, we still do it as an adjunct to every procedure for safety. A canthoplasty is when you actually have to cut the tendon and now you're moving it to a new place. And that is a procedure we do more in reconstructive cases, just like this patient here who had two kind of botched lower blepharoplasties, and now we have to reposition that tendon to get it back. And so here's an example of a patient who did more of this ponytail style, endoscopic style, brow and mid facelift, and we did not have to do a canthopexy at the same time because we had the orbicularis muscle itself was actually tightened to help create a sharper angle here to lift the lower lid, get this cheek up, and it kind of gives you this effect and that effect there. And she's only a couple days out of surgery in this photo, so she's obviously very bruised, and but overall healing great and looking great. But it is canthopexys, again, are very safe, very good as a surgical adjunct. Again, we pretty much do it with every lower blepharoplasty we do. A canthoplasty is something that more so we reserve for reconstructive cases, like that previous photo we showed. That patient had a couple of lower eyelid surgeries and had lower eyelid retraction. And sometimes a canthopexy isn't enough, and she had already had that tendon cut in a previous procedure. So we had to go back and do a few other things. She had that in combination with mid-face lifting. She did a deep plane face and neck lift at the same time, which helped to bring this up and get her lower lids to a better position again, which not only looks better, but helps the eyelids function better. Because if your eyelids don't close all the way or they're slightly exposed, even a millimeter or two can really cause your eyes to dry out. So only do a canthoplasty if there's something wrong with your lids. Otherwise, do not cut that tendon.